a question. You say you care about children in our state. 40% of births in our state are covered under Medicaid. So what do you plan to do to help us preserve Medicaid? Almost 500,000 people have been covered by Medicaid. And I'm also worried about our Social Security and our Medicare.
Yeah.
Our nursing homes would be shut down out here without Medicare and Medicaid.
Many hospitals.
But I'm especially concerned for the party that claims to be pro-life about children who could lose their Medicaid coverage.
I think I have as good of an idea as anybody about kids growing up in needs and what my family's experienced. So I can tell you that we have kids that are in need. It's the one thing we all agree on in the state of Nebraska. Our kids are our future. We never give up on kids. We have kids growing up in difficult sets of circumstances. We have to do better providing service, and we have to make sure that we can help lift them up. The biggest solution is education and getting trained in skill set, but we have to lift babies up. And at the state level, we're working very hard on it. All I can tell you is as your governor, I go to Washington, D.C. I was in the Department of Health and Human Services talking to a deputy before the previous administration when they were going to create a law that would require a registered nurse, 724-365, which would have shut down a whole bunch of nursing homes. So we have to have Medicaid reimbursement, and it's an essential piece of making sure that we take care of our kids. I talk to kids about dreams. I believe this in Nebraska. I believe that if there's any place in the world that can end poverty, it's Nebraska. Because we help neighbors, we lift up, and businesses are doing extraordinary things, and you have examples here where businesses are paying young people out of high school, sending them to a trade school, paying them because they need to be paid, and lifting up and growing their business. Those are all the things that we need to do to make sure that we lift up the kids and the families that need help. Yes, sir.
Governor, can you identify what steps you would take to protect Medicare, Medicaid, and Social Security?
Well, I mean, you're asking a federal question. I'm the governor of the state. So those are.
You can advocate on our behalf.
Yeah, no question, no question.
So what specific things will you do to advocate to protect those three programs?
Yeah, so I was in last Friday, I was in the Department of Health and Human Services, meeting folks within the group. So right now what we're working on is building relationships with people within the administration so that we can first have a relationship and then make sure that they understand how important they are. So I'm an advocate and trying to have influence on that process. So that's what I'm doing.